A brief introduction about yourself.
I am Dr. Raghav Aggarwal. I am director of Dr. M.L. Aggarwal Imaging Center at New Delhi. And I've been a faculty with PrimeRad and other institutions for about a long time now. And I'm doing MSK ultrasound since 2012 when I got trained in the URAR protocols.
From a teaching perspective, how useful is a mannequin with human-like anatomy for demonstrating ultrasound-guided procedures?
So what happens is in ultrasound-guided injections, we would show the students the videos and they would try to copy them, or we would do the hit the target and then do it. But when we do a mannequin, we have a sort of real life situation. And then we can mimic real life situations better. And when the student or you are doing an injection, because we do it regularly, when for the first time they are doing the injection, the hand-eye coordination is better, and we can create a real life like situation. And the repeatability is there because we have created a model in a way that it is just like the normal human anatomy. So instead of hit the target where we have just one point, now we are actually going through tissues which are more realistic, and there is, even in the mannequin, the feel is almost human-like. So, and also there are pockets where the fluid actually injects and goes. So it is almost like doing a real injection, because I cannot teach a real injection on a real patient because of ethical issues.
How important is that tissue-like resistance when training doctors in ultrasound-guided interventions, and were you able to get the same feeling on these mannequins?
So when you inject a patient, the first thing is the skin, which is the most painful thing. Then the subcutaneous fat comes, which is easy to maneuver. Then muscle or tendon would come. So in the mannequin, most of the tissues have almost a similar resistance. So the skin and the subcutaneous fat, you might find it slightly difficult, but entering the tendon gives you the same feeling. So you can actually have a real life push and the resistance which you have in an injection as doing on a live patient.
How do you see mannequins like this make the future training standardized across different locations?
So we are developing these mannequins over the time. We started doing it as a hit the target thing. Then we started trying with different tissue character and types. I think over the last 6 months, what we have achieved is quite real lifelike, and we're still working on it. So it actually makes things easier, more real time, more lifelike, and the repeatability is there. So I can teach the same thing again and again to the same student with the technique. I don't have to vary my technique, or just they don't have to imagine what they would be facing.